You know, when you picture an emergency, you probably imagine flashing lights, sirens, big dramatic life-saving stuff. But honestly, so many calls aren't like that at all. They're about connection, and they're about having to adapt on the fly under a ton of pressure. So today, we're going to open up the unseen toolkit EMTs use every day to care for patients with some very special challenges.
So let me just ask you this. What do you think is the single most important skill for an EMT? Really think about it. Is it getting an IV? Is it managing a really tough airway? CPR? I mean, yeah, of course, those are all absolutely critical. But what if the most important skill is something else? Something you can't really find in a textbook?
And that's the thing. It's about what happens beyond the standard protocols, beyond the XABCs. That's our checklist for massive hemorrhage, airway, breathing, and circulation. The real magic, the real game changer, is the ability to adapt, to totally change your approach, your communication, even how you do a physical exam in a split second. And that is what we are diving into right now.
Okay, so here's our game plan. First, we're going to look at why this kind of specialized care is needed more and more. Then, we'll get into the tough stuff, bridging communication gaps, adapting to different physical needs, and at-home tech. And finally, we'll zoom out to look at the bigger picture before we wrap it all up with what it really means to be a first responder today.
So why is this such a big deal right now? Well, it's pretty simple. Hospital stays are getting shorter, but medical technology is getting way better. That means more and more patients with really complex long-term conditions are living at home. And when something goes wrong, the EMT is the first person walking through that door into a situation that's way more complicated than just a broken bone.
And this right here is where the whole game changes. An EMT's team isn't just the other medics on the ambulance. The team is the parent, the spouse, the caregiver. These people are often the world's leading experts on this one specific patient. They know the gear, they know what's normal, they know what's not. Trusting every available member, the team approach, isn't just a nice little acronym, it's a lifeline.
All right, let's tackle our next big challenge. Just imagine for a second, your patient can't tell you where it hurts, or maybe they feel pain in a way that you or I would never recognize. This is the reality of trying to bridge massive gaps in communication and sensory perception.
I mean, just look at this. This completely flips a standard medical assessment on its head. For a patient on the autism spectrum, a serious, painful injury might make them hum or even laugh. The sound of a siren or something as simple as putting on a bandage could be totally overwhelming and terrifying. Your standard approach? It's just not going to work here. It might even make things worse.
So, what do? You adapt. You slow everything down. You explain every single thing you're about to do. You start your exam at the feet, which feels a lot less personal and threatening than starting at the head. You kill the lights and sirens, you let them hold on to a comfort item. This isn't just about being nice, you know? This is about being able to do your job and provide good medicine.
Communication barriers can be purely physical too. Take hearing loss. We've got basically two main types: sensory neural, which is nerve damage, and conductive, which is more of a plumbing problem. Something's blocking the sound. But here's the key insight for an EMT on a chaotic scene. Most hearing loss happens with higher frequencies, so shouting doesn't help. Just lowering the pitch of your voice can be the thing that cuts through.
And check this out. This is one of my favorite field tricks. Is absolutely brilliant. Using your stethoscope as a personal amplifier. It costs nothing, it takes 2 seconds, and it can instantly create a clear line of communication in the middle of a crazy emergency. That's adaptation at its finest.
Okay, so we've talked about sensory and communication challenges. Now let's shift gears and talk about physical ones. This covers everything from patients with chronic conditions that affect how they move to the very real and logistical challenges of bariatric care. When you're treating a patient with cerebral palsy, you've got a whole checklist of things to keep in mind: airway issues, fragile limbs, seizure risks. But look at that last point. Seriously, it might be the most important one on the slide. Never assume an intellectual disability. It's so easy to make assumptions, and it's so important that you don't. Respect is the foundation of good care.
And that idea of respect is front and center here too. When you're caring for a patient with obesity, the actual lift is the last thing you think about. Step 1 always is dignity. Step 2 is you ask the expert, and the expert is the patient. They know how to move their body. From there, it's all about teamwork, clear communication, and planning your moves before you make them. It's about being safe and, just as importantly, preserving dignity.
All right, now let's step into the modern age, where a person's life can literally depend on a machine that's humming away in their living room.
In these situations, EMTs have to become instant experts on some incredibly complex medical devices.
Okay, so picture this. Your patient has a tracheostomy tube, an artificial airway, and they can't breathe. It's a terrifying life-or-death emergency. The dope mnemonic is a paramedic's mental lifeline. It's a rapid-fire checklist. Is the tube displaced, obstructed? Could it be a pneumothorax, a collapsed lung, or is it just plain old equipment failure? This little tool brings order to the chaos.
Now this is one of the most wild things in all of medicine. A patient with an LVAD, basically a mechanical heart pump, can be sitting up, talking to you, totally alert, but have no pulse. None. The pump creates a continuous flow of blood. Now if an EMT doesn't know this, what are they going to do? They might start CPR on a conscious person. Instead, they have to adapt their assessment, looking at things like skin color and mental status to see if the body's getting the blood it needs.
And here we are again, right back to that team approach. Who knows that LVAD best? The caregiver who lives with it every single day. They know its alarms, its quirks, its history. They are a walking, talking instruction manual that is absolutely essential to that patient's care.
You know, the challenges aren't always medical. They're not always about the technology. Sometimes the toughest calls are deeply human, and they're about society. Let's look at how EMTs have to navigate things like poverty, homelessness, and the incredible responsibility of end-of-life care.
This slide shows a massive shift in the entire mission of an EMT. 99% of the time, their job is curative care. Find the problem, fix the problem, save the life. But when they get called for a patient in hospice, the goal flips completely. It becomes about palliative care, providing comfort, easing pain, and most importantly, honoring that person's wishes at the end of their life.
Take a look at this number, roughly 550,000. That's about how many people are experiencing homelessness on any given night here in the United States. It's a huge number, but for EMTs and paramedics, it's not a statistic. It's a person they might see every single day, and it brings a whole unique set of challenges that requires a special kind of compassion.
And that's where a simple phrase like this can be the most powerful medical tool on the ambulance. Shame and fear, they are massive barriers to getting care. Just saying, hey, this is a safe place, I'm here to help you, can break down those walls. It's what builds the trust you need to actually take care of someone in a really vulnerable moment.
So, after looking at all of this, all these different communicative, physical, technological, and social challenges, what does it really mean to be a first responder today? Well, it means your toolkit has to be a lot bigger and a lot more varied than most people think.
And this is it. This is that unseen toolkit we've been talking about this whole time. Empathy, to feel what someone else is going through. Communication, to understand them. Adaptability, to change your plan on a dime. Advocacy, to be a voice for someone who doesn't have one. And teamwork, to bring it all home. These soft skills are the things that make the hard medicine actually work.
So I'll just leave you with this one question to think about. Knowing the real depth of these challenges and the incredible human skills it takes to meet them, how does that change how you see the person who shows up when you call 911? It's so much more than just medicine, isn't it? It's humanity under pressure.